I see you here, and I know you're probably feeling confused, maybe even a little embarrassed about what you're experiencing. You're not alone in this. In my years of practice, I've had countless men over 50 sit across from me with the exact same concern you have right now. They come in wondering if something is wrong with them, questioning whether their body is betraying them in ways they never expected. Let me start by telling you something that might surprise you. Recent medical studies show that nearly 40% of men over 50 experience significant changes in their ejaculatory patterns, yet less than 15% ever discuss this with a healthcare professional. That means millions of men are suffering in silence, wondering if they're the only ones facing this challenge. You might be here because you've noticed you're ejaculating more frequently than you used to, or perhaps the volume has increased dramatically. Maybe you're experiencing this during times when you're not even sexually aroused, or it's happening in ways that are disrupting your daily life. These concerns are valid, and they're more common than the medical community often discusses openly. Here's what I want you to understand from the very beginning. Your body is trying to tell you something important. After age 50, your hormonal landscape shifts dramatically. Testosterone levels fluctuate, prostate health becomes more complex, and the delicate balance of your reproductive system can be affected by everything from medications you're taking to stress levels you're experiencing. But here's the crucial part that most men don't realize, and this is something that could change everything for you. The increase in ejaculatory frequency or volume isn't always a problem to be solved. Sometimes it's actually your body's way of protecting itself. However, there are specific warning signs that indicate when this change crosses the line from normal aging into something that requires immediate medical attention. Stay with me, because in the next few minutes, I'm going to reveal the one crucial factor that determines whether your experience is completely normal or a red flag that could be signaling a serious underlying condition that needs to be addressed right now. Now, let's get clear about what we're actually talking about when we say too much. This is where most men get confused, and frankly, where many doctors fail to provide adequate guidance. The medical definition of excessive ejaculation isn't about comparing yourself to other men or to your younger self. It's about understanding what your individual baseline should be at your current age and health status. For men over 50, normal ejaculatory frequency can range anywhere from twice a week to once every few weeks, depending on numerous factors including your overall health, medication use, stress levels, and relationship status. What matters isn't the number itself, but rather dramatic changes from your personal norm, especially when accompanied by other symptoms. Here's what's happening inside your body right now. After age 50, your prostate gland typically enlarges gradually. This isn't necessarily pathological, but it can affect the mechanics of ejaculation. Your seminal vesicles, which produce about 70% of your ejaculatory fluid, can become more active due to hormonal fluctuations. Meanwhile, your testosterone levels might be declining but not uniformly. Some men experience what we call hormonal surges, where testosterone spikes unpredictably. The volume aspect is equally important to understand. Normal ejaculatory volume ranges from 1.5 to 5 milliliters. If you're consistently producing volumes above this range, or if you've noticed a sudden increase of more than 50% from your baseline, this warrants attention. But here's the shocking truth that most men never learn. The timing of when these changes occur can reveal everything about what's causing them. If your increased frequency started gradually over months, that's completely different from changes that began suddenly over weeks. And there's one specific pattern that indicates a benign age-related change versus a pattern that signals something much more serious. Wait until you hear about the connection between sleep patterns and ejaculatory changes that researchers discovered just last year. That sleep connection I mentioned? Here it is. Recent research published in the Journal of Sexual Medicine found that men who experience disrupted REM sleep are 300% more likely to have irregular ejaculatory patterns. Your body produces most of its testosterone during deep sleep phases, and when that's disrupted, it creates a cascade effect on your entire reproductive system. But let's dig deeper into what's really driving these changes in your body. The primary culprit is often benign prostatic hyperplasia, or BPH. This affects over 80% of men by age 70, but it can start influencing ejaculatory function as early as your late 40s. When your prostate enlarges, it doesn't just affect urination. It changes the pressure dynamics during ejaculation, potentially causing increased volume or frequency of nocturnal emissions. Medications are another major factor that most men overlook. alpha blockers used for blood pressure, antidepressants, particularly SSRIs, and even some supplements like saw palmetto can significantly alter your ejaculatory response. If you started or changed any medications in the past 6 months and noticed these changes, there's likely a direct connection. Hormonal fluctuations create the most complex picture. While testosterone typically declines with age, it doesn't happen smoothly. You might experience what we call andropause surges, where testosterone levels spike temporarily, leading to increased libido and ejaculatory frequency. Simultaneously, changes in DHT, the more potent form of testosterone, can stimulate prostate activity. Diabetes deserves special attention here. Even pre-diabetic blood sugar levels can affect nerve sensitivity in your reproductive system. This can lead to what appears to be increased ejaculatory activity, but it's actually altered nerve signaling, creating false sensations and responses. But here's the hidden connection that most physicians miss entirely. There's one specific vitamin deficiency that's present in 85% of men experiencing these symptoms, and correcting it resolves the issue in most cases within 30 days. That vitamin deficiency I mentioned is vitamin D3, and here's why it matters so much. Your prostate tissue has vitamin D receptors throughout it, and deficiency disrupts the normal regulatory mechanisms that control prostatic fluid production. But let me tell you about the warning signs that indicate when your situation has moved beyond a simple nutritional issue. First, pay attention to pain or discomfort. If you're experiencing any burning, aching, or pressure in your pelvic area, lower back, or during ejaculation itself, this is not normal age-related change. This could indicate prostatitis, an enlarged prostate pressing on surrounding tissues, or even early signs of malignancy. Blood in your ejaculate is an immediate red flag. Even tiny amounts that create a pinkish tinge require urgent evaluation. While this can be caused by minor issues like small blood vessel ruptures, it can also be the first sign of prostate cancer, particularly in men over 50. Changes in ejaculate consistency or color beyond normal variation also demand attention. If your ejaculate has become consistently thick, clumpy, or has developed a yellow-green tint, this suggests infection or inflammation that needs treatment. The frequency pattern matters enormously. If you've gone from your normal pattern to ejaculating multiple times daily without conscious arousal, or if you're having frequent nocturnal emissions after years without them, this indicates significant hormonal or neurological changes. Here's the symptom that most men ignore but should never overlook. If your increased ejaculatory frequency is accompanied by urinary changes, difficulty starting urination, weak stream, or feeling like your bladder isn't completely empty, you're dealing with a prostate issue that could progress rapidly without intervention. But there's one specific combination of symptoms that requires emergency medical attention within 24 hours, and I'm going to tell you exactly what to watch for. That emergency combination I mentioned is this: sudden onset of increased ejaculatory frequency combined with fever, chills, and difficulty urinating. This triad suggests acute prostatitis or abscess formation, which can become life-threatening without immediate antibiotic treatment. Now let's focus on solutions. The good news is that most cases of increased ejaculatory frequency in men over 50 are manageable with the right approach. The key is identifying your specific underlying cause and targeting it directly. For vitamin D3 deficiency, which we've established affects 85% of these cases, optimal dosing is typically 4,000–5,000 IU daily with K2 for absorption. Most men see improvement within 2 to 3 weeks, with complete normalization by 30 days. However, you need proper testing first to determine your baseline levels. If BPH is the culprit, alpha blockers like tamsulosin can provide relief by relaxing prostate muscle tissue. For more significant enlargement, 5-alpha reductase inhibitors like finasteride can actually shrink prostate tissue over 6 to 12 months. These medications normalize ejaculatory patterns in about 75% of men within 3 months. Hormonal optimization is crucial but complex. If testosterone levels are genuinely low, replacement therapy can restore normal patterns. However, if your testosterone is actually adequate but fluctuating, stabilization with lifestyle changes is often more effective than hormone replacement. Sleep optimization cannot be overstated. Using a CPAP machine if you have sleep apnea, maintaining consistent sleep schedules, and ensuring 7 to 8 hours of quality sleep can resolve ejaculatory irregularities in many cases without any other intervention. Here's the treatment that surprises most men but works in 85% of cases: Pelvic floor physical therapy. Most men don't realize that pelvic floor dysfunction can cause exactly these symptoms, and specialized physical therapy resolves the issue completely. Part 6. Prevention and long-term health. 10 to 12 minutes. That pelvic floor connection is revolutionary because it addresses something most urologists overlook. Your pelvic floor muscles control ejaculatory timing and intensity. When these muscles become tight or dysfunctional due to prolonged sitting, stress, or previous injuries, they can trigger excessive ejaculatory responses. Specialized therapists can teach you exercises that restore normal function within 8 to 12 weeks. But let's talk about preventing these issues before they start. The foundation of prostate health after 50 begins with what you eat daily. Lycopene-rich foods like tomatoes, watermelon, and pink grapefruit have been shown to reduce prostate inflammation by up to 40%. Zinc from pumpkin seeds, oysters, and grass-fed beef maintains optimal testosterone production and prostate function. Regular exercise isn't optional for men over 50. Specifically, resistance training maintains testosterone levels naturally, while cardiovascular exercise improves blood flow to reproductive organs. Even 150 minutes of moderate exercise weekly can reduce your risk of developing problematic ejaculatory changes by 60%. Stress management directly impacts your hormonal balance. Chronic stress elevates cortisol, which suppresses testosterone and disrupts normal ejaculatory patterns. Whether through meditation, yoga, or regular massage, finding effective stress reduction techniques is essential for maintaining sexual health. Here's what I want you to understand above all else. Your body is remarkably resilient and responsive to positive changes. Most men who implement these strategies see significant improvement within 30-60 days. You don't have to accept changes in your sexual function as an inevitable part of aging. The most important step you can take right now is to track your symptoms for 2 weeks. Note frequency, timing, any associated symptoms, and potential triggers. This information will be invaluable when you speak with your healthcare provider. Remember, millions of men face these exact challenges, and effective solutions exist. You deserve to feel confident and healthy in your body, regardless of your age. Take action today, because your future self will thank you.